Well, about a month ago, the South Korean government decided to shift toward its sort of living with COVID-19 approach. And yeah, it lasted for about a month. Restrictions now are almost as severe as they've ever been. Every restaurant and bar has to close at 9 p.m. And then, sort of, the signature South Korean restriction is the restriction on the number of people who can gather even privately. Right now, you can only have 4 people that gather in public or in private at your home, not counting your family members, of course, but only 4 people can gather in public or private, and they must go home at 9 p.m.
So in a sense, they seem to have abandoned the living with COVID approach.
Yeah, it's pretty well abandoned. I mean, they tried it for a month, and they did it cautiously. They opened it gradually. And sort of the depressing thing about this, I must say, is the fact that South Korea really is among the most vaccinated countries in the world. About 82% of the entire population is vaccinated here. They tried very gradually to switch toward a living with COVID approach. And really, after a month, they're already abandoning it. So it doesn't necessarily say good things about, how long this whole pandemic is going to last in South Korea.
Well, here in Australia, we don't focus so much on the case numbers anymore. What's really important is the number of people sick in hospital. Is that the case there? What's the situation with the health system?
Yeah, I mean, it's important to put it in a global perspective, right? South Korea is not anywhere near what it has been. The pandemic here isn't anywhere near what it's been in many other countries where it's gotten really bad. You have about 60 people or 70 people dying per day, which is serious. I don't want to, to act like it's not. We've seen about 7,000 cases per day, but more importantly, the number of severe cases and the number of ICU beds in hospitals has been really, really right at the maximum amount for a lot of weeks now. And you're just now starting to see the hospitals overflow. Last week, we had 17 people who died without access to hospital beds. So that's serious. And, there isn't much political tolerance to allow this to be the case, to be this way long term. This is a very sensitive issue politically. And so there really is a lot of appetite because of these factors I mentioned to return to a tighter lockdown state.
How would you compare the state that South Korea is in now to previous peaks in the pandemic? Is this the worst it's ever been?
Yeah, it's basically the worst it's ever been. There was a period where you could only hang out with one other person. So you could pick their one friend and you could go get coffee or go get drinks and you could stay out until 9 p.m. Right now you can do that with 4 people. But still, basically every business closes at 9 p.m. There are some that are open till 10 p.m. if you're able to wear masks inside and things. But really, this feels as severe as it's gotten. And you really have to wonder, where's the exit strategy, I think? Unless you're a country like the United States that is able to tolerate a higher level of people dying. That's not the case here. So what is the exit strategy? Is it just going to be a situation where people in South Korea for much of the year can't go out after 9 p.m. or 10 p.m.? It's a real question. I don't know that people are really thinking about this in terms of how long this will last. They're just trying to survive, I think, from day to day and not let the hospitals be overwhelmed.
Well, what have authorities said about that? Do they have a plan outlined? And how has the Omicron variant changed things?
It really feels like South Korean officials are sort of taking this one step at a time. And I must say, for as bad as things look here in certain ways, there's never really been a question that the South Korean government has this under control. It has never spread out of control. You always had the sense that they could sort of tweak their social distancing guidelines a little bit here, a little bit there, and get the numbers back down. I think that's what will happen here. I think this will be temporary. But even if it lasts a few months, that's still sort of depressing, seeing the fact that they couldn't actually shift into a more living with COVID approach. As for Omicron, they've identified about 150 cases here. It seems that Delta, though, is the main variant that is really, really affecting South Korea for now.
And William, how open has the border been in recent weeks, given the latest developments with Omicron?
So with the onset of Omicron, South Korea actually has reinstated a mandatory 10-day quarantine for all entrants into South Korea. And that might be the case until they sort of get the sense that Omicron, get an idea of what Omicron is. They have also banned migration from many different parts of South Africa. So, there are pretty tight restrictions. It's never been as tight, for instance, as neighboring Japan. But once you come here, you decide to come here, you're going to have to spend at least 10 days in quarantine.
Meanwhile, you believe the development of pills to help treat COVID would be particularly good news for North Korea. What can you tell us about that?
Yeah, the thing is, North Korea, we have very little, obviously very little idea of what's going there at any time, especially during the pandemic, since there's basically no foreigners there. But what we do know is that North Korea has no tool to combat the pandemic other than severe lockdowns. And it's entering year 3 of probably the world's toughest COVID-19 lockdown. If these pills, most prominently the one produced by Pfizer, could actually be shipped to North Korea, this could provide them a single tool besides lockdowns to actually combat the pandemic. These Pfizer test results are very good, suggesting that 90% they could cut the risk of hospitalization and death by about 90% if taken within the first 5 days. It actually is much easier to ship these pills also to North Korea. That was one of the concerns about vaccines. They haven't accepted vaccines because they don't want to allow in foreign staff, among many other reasons, foreign staff that would actually oversee any vaccine campaign. So if, and it's a big if, the world can figure out a way to get these pills to North Korea, it would be big because it's an actual way to fight the pandemic for North Korea.
William Gallo, thank you so much.
Thank you so much.